Hi, I'm Dr. Ashley Fuller.
And I'm Dr. Meredith McClure.
And this is Labia Logic,
the podcast that's all vulva, no filter.
We're here to talk about all the stuff your doctor rushed through, the questions you've been too embarrassed to ask, and the sex ed that barely mentioned the vulva.
Because too many people are suffering in silence with painful sex, menopause misery, and vulvar issues no one talks about.
No shame, no stigma, just real talk, real answers, and the education you should have gotten in the first place.
Hello, and welcome back to Labia Logic. Today, we're talking about vulva glow-ups, also known as labiaplasties, but we're calling this labiablasty.
I love it. Let's talk about labiaplasties and vulva glow-ups. I'm here for it.
Me too. And it's a thing we hear about a lot, actually. So I think it's a good thing to talk about the, pros, cons, why one would consider doing it, when to not do it, possibly. And we're happy to talk about this today.
I think the biggest thing I want to talk about is that, we all look different down there. Like the vulva, everybody's vulva looks a little bit different. And it is not always symmetric. Like sometimes one labia minora, the smaller lips, one will be longer than the other or look a little different than the other, especially if you've had a baby. Like oftentimes things change after that. I want people to feel good in their own bodies and confident with how they look, but also like we don't all need to try to look like porn stars because that's not realistic. And the process of getting there is often painful and actually can have a lot of unwanted complications and may end up actually causing more harm than good. So we all look different. If you want to see how different, a lot of women have said they've never seen anyone else's labia really. So we've talked about this in other episodes, the wall of vulva. It's an art installation kind of thing when they have all these different plastered vulvas on there and they're all so different. And I think it's really good to look at so you can see just the wide variation of how different people's vulvas look.
Yeah, I gave a talk last night and I have a slide and it's a bunch of cartoons of vulvas in all different shapes, sizes and colors, and it's kind of everyone is always like, whoa. And it's true. There's so many variations.
So first, let's talk about what is a labiaplasty. This is surgery to reshape or reduce usually the labia minora, so the smaller lips, usually for cosmetic reasons. Although there are some reasons that people could do this that are not cosmetic. So let's talk about that first. So sometimes people will have one labia minora, and I've seen this that is significantly longer than the other. And they feel like it gets caught, like they're trying to exercise and it gets caught in their underwear or like it pulls. Because I think sometimes when one of them is a little bit longer, it'll start pulling a little bit more and then it keeps elongating. That can happen. And that can be really, really bothersome or actually impede people from doing their normal activities. Or if there's rubbing or it's causing a lot of pain, I usually try to manage those things non-surgically first, but definitely those are reasons that it could be possibly appropriate or a good idea to have a surgical change for it.
Yeah, just like a skin tag on your neck or something that can kind of keeps growing the more it rubs. These can do similar things and enlarge when they have friction around. And the vulva has a lot of friction. She takes a lot of trauma, that vulva. So sometimes it does happen. Also, I think sometimes for people, if it is longer, it could kind of change your urine stream. And that might be distressing for some people. So then those are kind of reasons I think that would be bothersome if one labia was bigger than the other.
I just remember that it's normal to have different variations of labia. It's not uncommon for one side to look different and they change in different parts of our lives, right? Hormones change them, childbirth changes them. So this idea that we should be kind of aiming to have prepubescent, no labia minora, like what children look like, I think is a kind of a weird thing to think of.
Mm-hmm.
But
Yeah.
definitely seems like societal pressure makes people feel like that's the way they're supposed to look.
Yeah. And there's things that we come across in our life that can make them change. Some birth control pills can make labia smaller. Menopause is for sure one thing. So, and ultimately, we all know if you live long enough, you will get menopause and they can get smaller. They don't always get smaller, but I have seen women have a labiaplasty, then go into menopause and they got even smaller.
Right. So the way birth control pills can change labia is just by the hormonal changes that come with birth control pills. So yeah, our labia change throughout our lifetimes. So another reason to look down there and so you can kind of get a sense of what's happening. I think we already talked about why people could do it. We talked about, the tugging if there's one that's much bigger. I don't want to downplay body confidence. I have some women tell me, like, "I'm just embarrassed to wear a swimsuit because I feel like I look funny down there because my labia minora are too long." I always want people to feel really comfortable in their own bodies. So, although, like, we're probably gonna say, like, we're all different and generally we don't recommend a labiaplasty, if this is something that, like, on a regular basis is something that it makes you feel self-conscious, then I definitely think there are people that will really benefit from this procedure. So, I want people to feel comfortable in their own bodies, comfortable with their sexual partner, that just feel confident in who they are.
But we also don't want you to feel pressure to do it if that's not something you want to do. If a partner is telling you that that's something you need to do, we support in standing your ground and doing what you feel is right for you.
So there are some things if you feel like you have one labia that's longer than the other, or you having irritation, or think of those things are tugging. There are some things you can do to start with that are not surgical. Like you could get different kinds of underwear and use topical lubricants or barrier creams to kind of help kind of protect that tissue differently. Meredith, you have some other ideas of things that they could do that are not surgical. That's kind of the main stuff.
That's kind of the main thing. If it's a friction thing, keeping them covered and trying to kind of protect them so they're not getting stuck or pulled on. Because again, that can make them grow more if that's a kind of a consistent thing happening.
There are certain people that should never really do it. And so, one of the things that ACOG, our professional society, the American College of Obstetrics and Gynecology, recommends is that adolescents, women under 18, girls under 18, should not do this purely for cosmetic reasons. I think that that is really good because I think that just changing your body when you're so young, I think is, not a great idea, especially if it's for cosmetic reasons. Now, I have had a teenager have one labia that was much longer than the other that was keeping her from playing sports and doing the things she loved to do because it was so uncomfortable for her. So I think that's a different situation. So, but generally, ACOG does not recommend that girls under 18 have any kind of labial surgeries for cosmetic reasons.
Agreed.
If you were going to do this, it is important to kind of optimize your outcome. I think it is important to think through why you're doing it. Is it for to feel more confident, making sure that it's not, like a body dysmorphic disorder, making sure it's not like unprocessed sexual trauma that you kind of haven't thought through, or trying to change your body to kind of process something that has happened. So I think those kind of things are important. And then you already mentioned like the coercion or pressure from a partner, like making sure that that's not going on.
I think it's important when we sit down with patients, it's what are your goals? Tell me. Let's talk about it. Talk it through. And this is one of those situations where, it's body autonomy and really trying to figure out where you want to go with this and what are your goals and an expected outcome.
All right. So some things to think about if you are going to do this procedure is that, the labia have a ton of blood flow to them. They can bleed. And so we really want to optimize our wound healing because these little flaps of tissue actually can have a lot of wound issues and healing issues. So if you smoke or you have uncontrolled diabetes, those are things that you want to get control of or stop smoking prior to this. It's really important to have realistic expectations of what this is going to look like. It won't be perfect. It might be more what you're looking for, but it may still not be perfect. And there's possibility that there could be scars or still like some asymmetry, things like that. Generally the labia heal well, but it sometimes takes a while.
Just like any surgery, there can be complications with wound healing. And then if that does happen, then cosmetic results of that might not be up to your expectations. When I've done surgeries on labia, I maybe leave and cross my fingers, do a dance, and just pray that they don't bleed and get a big fat hematoma, which is like a big collection of blood. Like it's real. It does happen. And people will have to sometimes go back to the operating room.
Yes. You're triggering me right now. Wish you would have warned me you were gonna say that because yeah. Oh, those labia, they can be problems. So, yeah, they can bleed and they can cause hematomas. There's 2 main techniques that considered surgeons will use for labiaplasties. So, there can be a trim technique where they'll take the labia minora and actually trim the edges and just close the edges, or there's a technique where they take a wedge. There's a little bit of data that the wedge technique might be a little bit better, partly because they take out like a triangle wedge at kind of the bottom third of the labia, like in the middle, and it pulls down the upper labia. So you maintain the same edge that you had before, but you're basically moving tissue and then putting it back together. And so there's a higher risk of dehiscence or that opening back up. And sometimes you can see a scar in that area. So the complications will vary based on technique. But you also have to be prepared for could there be change in sensation? There's nerves in there. And once you've altered them or altered the tissue there, it may change your sensation or even could lead to painful sex or pain there.
we've kind of been talking about just about labia minora, but some people will have a reduction of the clitoral hood as well. In that northern region of your vulva, there's, I mean, the clitoris, obviously, in the head, the body glands, clitoris has tons and tons of nerve endings, like we've discussed, but in and around there, there's a lot of nerves and blood flow, but the glands or head of the clitoris has these little frenulum, which are kind of like if you're looking at a ball and you imagine it like 4 and 7 o'clock kind of little flaps almost that come down. And those really will become the labia minora.
Right.
And so some people might get a little too much on the trim up north and compromise that nerve and vessel bundles that exist there, and that can definitely impact sexual function, sensation, orgasmic potential, things like that, and then even in around the clitoral hood. So in that northern region, it's an area to give mass respect to and be cautious, and not over zealous on your removals.
I mean, there can be occasionally catastrophic outcomes. So I think if you're going to do this, you should choose a surgeon that does this a lot. And I think that's hard because a lot of gynecologists who are, general OBGYNs are going to say, like, we generally don't do a ton of these. I mean, we do them, but not a ton. And so then you're kind of left with like the idea of going to a cosmetic gynecologist or a plastic surgeon. I would always ask to see like some before and after photos, ask like what their volume is, what kind of complications that they think could happen with your specific surgery. But I think more knowledge is better. And I think a little bit of less is more because if you take too much, you can never get it back, right? You could always have a revision if you felt like not enough was removed. But if you take too much, then that's all there is. So I would just be cautious and to try to get as much information prior to.
This is surgery, and surgery is not always easy and one and done. Like these are things you really need to kind of think about and consider.
I have heard stories of women who had actual clitoral tissue that was underneath the labia inadvertently removed during a labiaplasty, and it really changed their ability to orgasm and their sensation. So that's why I think going to someone who does a lot of these is important and knowing what you're getting into.
For sure.
Recovery from this is not super fun, I would say. It looks very painful. So if you're doing this, I'd be prepare for a week or two of really like being home, icing it, sitz baths, and really letting those wounds heal as best as possible. Usually after the first 2 weeks, things improve quite a bit. I remember when I used to do these procedures, that first week, I would almost always get some calls about how bad the pain was.
I mean, when you have this, you have tiny, tiny stitches, and generally there's multiple of them down there, and that they get stuck on things. You do your best to kind of make sure it's not big knots and things like that it can pull, but you go to the bathroom and you wipe and underwear and things like that. And initially there's pain, but then as those things start healing, it's a lot of itching. That's the biggest thing people will say when that tissue starts healing. It's itching. And of course, it's not an area with stitches and wounds that you want to start scratching.
Is there anything else we should say about labiaplasty, labiablasty?
One, do what's right for you and find someone who is experienced and is going to walk you through that, and let them also tell you the risks and the benefits. I think so many people get taken to surgery and they don't get told anything. I don't know about you, but when I did surgery, we would go through everything. I was like, I would tell people, I don't want you to wake up from surgery and say, I did not know that could happen to me.
Absolutely. I agree. And, I think for this procedure, people are going to talk about, possibility of still having asymmetry or scarring, change sensation, possible pain. That's what I used to tell patients. Like, although I can see why you're doing this, there's a possibility that you could have pain afterwards or a change in sensation. And then always possibly needing a revision. And I definitely had ones that needed revision based on how they healed.
All right. So I think we did labiaplasty. There's some other things out there that people can do to their vulva glow up regimen.
Vulva glow up.
What else can we talk about in the glow up?
I mean, there is this thing called labia majora puffing. And I kind of wonder if this is getting more popular now that people are talking about Ozempic vulva. Like, that's like a thing
Oh,
people are
yeah.
talking about, right? That like with rapid weight loss, I mean, a lot of what's in the labia majora, your hair bearing lips is mostly fat. It's a cushion. And so when we lose fat rapidly on some of these weight loss medications, people sometimes feel like those get saggy because they've lost fat there. So labia majora puffing is actually putting fillers or fat grafting into those areas. I think only a cosmetic GYN probably does this. I mean, we don't do these. No, you're like, no. So I think that there could be some short-term gains from this, and some people may like this, but I definitely think there's a lot of side effects that could happen. You get nodules in there. You don't know how symmetric it will be. You don't know if it will be uniformly cushioned or like there'll be spots that aren't. Also, what they inject could migrate. There's pitfalls there.
Yeah. Again, find someone who's experienced and know what you're getting into and what your goals are. So,
Yeah, I would also see before and after pictures and ask realistic questions about what to expect for recovery and possibility of bad outcomes, that kind of thing.
other things people might do, there's things that are like they'll use like energy devices and stuff. We're going to get into that a little bit in our next episode and talk about vaginal procedures and vaginal rejuvenation.
Yes.
But right there at the vulva, I think some people might say, hey, I'm not tight, things like that. It's not the same. And so some people might have like what they call like a perineorrhaphy, where they kind of, it's almost like, I mean, I think these things have sometimes fancy terms, but really it's a lot of what we did when we delivered your babies out of your vagina and put that all back together. But that is kind of just almost making a little cut, kind of similar to that, and kind of tightening that 6 o'clock at the vaginal opening up a little bit. There's a little more, obviously, intricacies to it, but the gist is they're kind of tightening that opening.
Right.
If you're kind of not feeling like it's more loose or gas is coming out, things like that. That's the thing sometimes people will do. And then, of course, there's the shots.
If you had a couple babies and you feel like the vaginal opening is gaping a little bit more, sometimes people will get air caught up in there just doing normal things and they can have escape of that air and it will make noises.
And that could be distressing for a lot of people.
I was laughing at the word in my head,
You're good. You're good.
the queef word. And
Yeah.
so that's why I was laughing. It is very distressing and it's something they can't control. And so a perineorrhaphy could potentially help that because it's going to narrow that opening so that potentially, air wouldn't get caught. So there are real reasons to do any of these things, but the more information you have about expectations and outcomes, I think is better.
And these procedures, they can hurt. So there's a lot involved. Sometimes people might have had a traumatic birth experience or other reasons for why this is happening to them. So this isn't just get a surgery and be done. It's like, let's kind of process if it was something traumatic that made this happen and how this is so distressing to you. Like, how is that affecting your mental health and what your expectations are at the surgery? I think these are also important things to talk about and not just run to surgery and be like, and you're done.
Yeah. If there's trauma involved in how you got to this place of wanting this, then I definitely think processing that to really optimize your outcome so that it's not, yeah, I definitely think that's important.
Whole person needs to be treated.
Whole person. Yeah.
Yeah.
All right. The shots. Tell us about G-spot shots, Meredith.
So there's these shots. They're normally a letter and a shot. G spot, there's the O shot, there's a P shot, which don't come to us for that because we don't treat penis.
Yes, no.
That's not us. But generally, these are shots using, they'll draw your blood and kind of spin it and get the plasma. And it's a platelet rich plasma. And they will inject it. And they will inject it into the hood of the clitoris, sometimes the body of the clitoris. And then the G spot, which is kind of in the top wall of the vagina, just kind of past the opening, which is, in theory, it's kind of the female prostate lives in that vicinity. We have friends that call it the G zone, and they will inject this. They kind of puff it up, I guess, and put some more things in there to get blood flow and all that. And possibly could that help you with pleasure and orgasm?
Possibly.
Possibly.
I've had patients do it. I haven't had great outcomes. I don't perform this procedure, neither does Meredith.
No.
I definitely see patients that come to see me to talk about orgasm, muted orgasm, problems with orgasm. And just to let you know, January is going to be orgasm month on Labia Logic. So we are going to be talking a lot more about that. But definitely have sometimes see patients come in who've tried this to help them with orgasm. And I generally have not seen it that has helped them quite very much. Is that your experience also?
I agree. They're expensive. It comes at a cost. And again, it's another procedure, possibly anesthesia, things like that you have to think about. There's a lot of stuff in the sexual medicine realm that I feel you're paying a lot. You have a high expectation of what's going to happen. And I think there's a fair placebo effect in some of this stuff too. So it's really hard to look at it. And I think the studies and the data on this are very limited and small in numbers. So it's kind of hard to take away from that if you're a data nerd. But they do exist and they are out there. So I think it's important to kind of talk about it and bring it up.
kind of summarize the things we've talked about. You should understand your body, know what your goals are, and have a clinician that can really be there for you in partnering with you to reach those goals. And I think it's important to have a clinician that also knows what they're doing in the sense of like they understand vulvas and that they can actually make sure you don't have some underlying condition that's caused some of this. Like operating on untreated lichen sclerosis or lichen planus would be really bad.
Really bad.
That's not going to heal well. And so making sure that you've had evaluations to evaluate what else could be going on, I also think is really important.
Yeah. Maybe you have orgasmic trouble and you're looking into getting a procedure there, but yet you have lichen sclerosis and like we've talked about, and you have an adhesion on your clitoris, and those procedures are not going to help that. And it's not going to heal well until you treat your lichen sclerosis and get that inactive.
And then I think having appropriate expectations of outcomes. I would be cautious of some of the marketing that comes from some of these places. So if you have somebody that's trying to sell you a combo package of like a bunch of different procedures all together, it always makes me a little bit
Red flaggy.
a little red flaggy, a little bit, I don't know. I don't have any combo procedures. Maybe I need to work on that. I'm kidding.
A package
A
deal.
package. I don't have any package deals.
Vulva package.
Vulva glow up package. What I want is for you to feel confident in your vulvar health. I want your vulva to, honestly, I want your vulva to be something you don't think about. I want you to get through your day and most days and not think about your vulva. And I want you to be able to have pleasurable intimacy. And so it looks different for different patients, but I think having someone that you can partner with that you trust that's practicing mostly evidence-based medicine and really cares about your outcomes is really important.
Your body, your choice.
Your body, your choice.
Your vulva, your choice.
That's right. That's right. I think that if you want more information about this, there's some places you can go look. I think ISSVD, so International Society for the Study of Vulvovaginal Disease, has some recommendations on cosmetic general surgery, probably recommending against it. And then we talked about ACOG having some committee opinions about some of this in minors, things like that. If I was going to look at one thing, if you were considering this because of cosmetic reasons, I would look at that wall of vulva, just so you can get a sense of how different everybody's vulva looks.
Yeah. And we can put those resources in our show notes.
All right. Well, next time we're going to talk about vaginal rejuvenation on our Vulva Glow Up month. But we appreciate you being here today, and we appreciate you listening to Labia Logic. If you are liking our content, tell your friends. You don't have to be embarrassed. 51% of us have vulvas. So share away. And if you're liking our content, leave a comment or a like on whatever platform you are listening to us. And if you have something you want us to talk about, we can talk about vulvas forever. So we have lots more content coming your way. But if you have something specific you want us to talk about, please let us know. We're open to ideas. Thanks for joining us for this episode of Labia Logic.
We get it. Sharing a podcast like this might feel a little taboo, but we're here to break down those barriers. Labia Logic's all about empowerment, not embarrassment.
If you found this episode helpful, we hope you share it with others who could use a little Labia Logic in their lives. Can't we all? You can find us on all major podcast platforms and connect with us on Instagram at labia_logic.
From our lips to yours,
Viva la vulva!